Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minjury, and I'm so glad you are listening today. On today's episode, we're going to talk about perimenopause, which is considered the time leading up to when menopause occurs. We will give some clarification as to what defines perimenopause versus menopause, and we'll also look at the natural progression of what happens to your cycles before they stop altogether, as well as discuss treatment strategies to manage your symptoms as needed. So let's start off today with a story about a patient of mine who we'll call Anna. Now, Anna came to see me at about 45 years old because her menstrual cycles were getting to be more irregular. She was noticing that her periods were happening less frequently. She also had some months she was bleeding more days than usual, but other months that she was bleeding much less than usual. Now, this was concerning for Anna because she felt like she could never predict when her menses was coming or how to deal with the irregular pattern of bleeding. On top of this, she was beginning to notice more issues with mood swings and even some hot flashes. Anna was not wanting to go on any type of birth control as she didn't want to deal with more potential side effects, and she wanted to try and manage her symptoms more naturally. She had already been charting her cycles, so she had a great history as to when her cycles were happening and was also able to specifically have details about how heavy her cycle was and show how that had changed over time. Now, this was incredibly useful as we continued to monitor how Anna's body responded to different lifestyle interventions that we eventually implemented to help manage her symptoms more naturally. So after we checked some blood work and confirmed there were no other underlying causes of her symptoms, Anna and I worked together to develop a plan that included some significant changes in her lifestyle, including her diet, exercise, and sleep habits. We also went through her current supplements and made some changes there as well. Over the course of the next few months, Anna was able to manage her symptoms more effectively, and although her cycles were still a bit irregular until they stopped altogether, she had a better understanding of what was going on with her cycle and how that was going to affect her on a day-to-day basis. So let's start with talking a little more as far as how we define perimenopause and how that transition can look different for different individuals. Now, in Anna's case, she had been tracking her cycles and knew what was usual for her with her menstrual cycles. She started to realize that things had changed, and that's the most common thing that we see with perimenopause, is that there is a change in either the frequency or the amount of menstrual bleeding that a woman experiences. For most women, they may start to notice this change sometime in their 40s. Now, unfortunately, there's not a great calculator that tells us how much time there is between when your cycles start to get a little bit more irregular and when you'll actually stop having your periods. By definition, perimenopause is classified as anything that's a consistent change with those menstrual symptoms, which typically can happen up to 8 or even 10 years prior to full menopause. Other symptoms of perimenopause can include hot flashes or night sweats, mood changes or feeling like you're on an emotional roller coaster, sleep troubles, and that can be either troubles with falling asleep or troubles with nighttime awakenings, specific food cravings, an increase in headaches or stress, changes in libido or sex drive, and an increase in vaginal dryness or pain with intercourse, which is specifically related to low estrogen levels. Now, you don't need to have all of these symptoms to be considered in perimenopause, and some women may actually have a combination of some of these concerns, while others experience little to no issues. Now, when we diagnose menopause, that's not until you have been completely without a menstrual cycle for an entire 12 months. At that point in time, if there is any bleeding whatsoever that occurs beyond that 12 months of not having cycles, you definitely need to have further evaluation to rule out any other underlying cause that would be causing that bleeding. So there are a few things that we look at with perimenopause that help us determine if that's actually what's going on or if there's some other underlying abnormality that may be causing your symptoms. I always like to check FSH, which is follicle stimulating hormone, estradiol or your estrogen levels, and TSH, or thyroid stimulating hormone, as well as some other thyroid labs to make sure there's not some other underlying cause that's going on. Now, the FSH and estradiol levels aren't a specific science as to the exact numbers, but it can help give us a baseline as far as where things are at, and if it looks like you're headed towards that menopausal transition. What we notice is that the follicle-stimulating hormone will start to increase because your body is trying to work harder in order to make ovulation occur. Your estradiol levels actually will start to decrease. Now, the decrease in estrogen levels is one of the most common hormonal shifts that happens during menopause. However, interestingly enough, we sometimes actually see a slight increase in estrogen during the perimenopausal time, and some women will determine that they have symptoms of estrogen dominance. Again, your body is trying to work to increase those levels and get things back to a baseline normal for you. These fluctuations are part of the reason why women can have such significant changes throughout that perimenopause timeframe, because the hormone levels can really increase and decrease fairly quickly, even from day to day. In addition to lab work evaluation, if there's any significantly heavy bleeding, we always want to make sure that we're checking an ultrasound of the uterine lining to make sure that there's no other anatomic cause of the bleeding symptoms. One common thing we see is that fibroids become much more frequently diagnosed in a woman's 40s, and treatment of fibroids is very different than how we would treat somebody who is in perimenopause. So again, knowing what we're treating is really crucial here to get the correct diagnosis. The other piece is that we always recommend that women who are having any type of menstrual cycle are still charting their cycles and using their fertility awareness methods. The idea is to be able to track what's happening over time, as well as monitor for times when you are fertile if the intention is to avoid pregnancy during this time frame. Even though ovulation can be slowing down or happening less frequently, women can and do still ovulate up until the time of menopause, which makes pregnancy a possibility. Charting also helps you to have a better understanding of when your cycles are going to occur, documenting how heavy they are and what we can be doing to help reduce or minimize symptoms that are occurring. You know, the interesting part about perimenopause when it comes to treatment is that we place our focus on symptom relief rather than treating to a particular lab result. And so for some women, we don't actually recommend any medications. Sometimes it's just a matter of providing education about what's happening in this phase of life and helping women find a way to manage those symptoms. It's important to realize that not all women in perimenopause require hormone replacement therapy. Now, there are certainly some cases where prescribing someone to take bioidentical progesterone therapy can be really beneficial for helping with her cycles. This is especially the case for women who are having lots of symptoms or those whose cycles are really erratic. However, it's not always the only answer for women. Another thing we talk about are different vitamins and supplements that can help to manage that perimenopausal transition. We do place a lot of emphasis on eating a well-rounded diet, but especially focus on getting adequate calcium intake, whether that's through your diet or with the addition of a supplement. Most women during this time should be getting somewhere between 1,500 to 1,800 milligrams of calcium per day. As our estrogen levels decrease, women have a harder time with keeping their bone density adequate. And over time, this can cause osteoporosis or thinning of the bones. So it's really important to make sure that we keep our calcium levels up in order to prevent osteoporosis, as our bones need adequate calcium, among other things, to keep the bones as dense as they need to be. The other vitamins or supplements that we recommend are typically specified based on what's going on with your cycle. So if you're somebody who's dealing with more stress levels, or if you have other vitamin deficiencies going on, we make recommendations unique to you based on your situation. Another thing that is important for all women, but especially during the perimenopausal time, would be taking a really good look at your lifestyle, your daily habits, specifically in regards to diet, exercise, and sleep. Now, I understand that you may not be able to improve on every single one of these things, but working through which lifestyle changes actually can make a difference for you can really help you understand how those changes positively impact your health, not just from a hormonal standpoint, but also when it comes to your weight, your stress levels, and your overall wellness. So let's start with diet, including anything that you eat or drink. Now, depending upon what symptoms you're having with perimenopause, there's actually really good data that shows that women who experience hot flashes can have a reduction in those symptoms if they reduce or eliminate altogether alcohol and caffeine from their diet. Now, that's not necessarily the case for every single woman out there, but if you're specifically struggling with hot flashes, that may be a good place to start, to try and eliminate alcohol and caffeine from your diet, as they can be quite inflammatory. The other pieces that we look at are that women have a harder time with keeping their metabolism up as they are entering that perimenopausal stage, as well as transitioning into postmenopausal timeframe. We will often see elevations in cholesterol levels during this time as well, since the creation of cholesterol corresponds with decreasing estrogen and ovulatory hormones. In order to combat this, we talk a lot about trying to decrease your overall highly saturated fats and carbohydrate consumption, which includes breads, pasta, sweets, and starchy foods. Now, please do not try to cut these out altogether, as it's really important to have a good variety of whole grains in your diet. And you can actually have some significant side effects if you try to cut out carbs altogether over time. Overall, we're looking to try and avoid processed foods in general. Eating more whole foods and limiting your amounts of white flour, white sugar in your diet, and really just trying to keep things a lot more natural is going to be beneficial in so many ways. Certainly, it's always important to get a good variety of colorful fruits and vegetables throughout the day, as that can make a huge difference not only from a health and weight standpoint, but also from a restorative standpoint of cells throughout your body. We know that consuming a diet that is higher in colorful foods like fruits and vegetables, which are naturally higher in antioxidants, can repair free radicals, which helps to prevent cancer and other inflammation throughout your body. So really try to focus on getting that rainbow of food on your plate at each meal. The next piece that we talk about in regards to lifestyle changes has to do with your sleep. Now, sleep can be hugely impacted throughout perimenopause and into the years after menopause, especially if you're having hot flashes or night sweats. Making sure that you set aside enough time for adequate sleep is really beneficial, and the recommendation here is looking for a minimum of 7 to 8 hours of sleep per night. You also want to be aware of looking at ways to minimize any interruptions to your sleep. So some of the things that we talk about from a sleep hygiene standpoint include making sure that you don't have any screen time at least 1 hour prior to bedtime. Now, this includes phone, electronic devices, TV, computer, anything that has that artificial light. Keeping your phone out of reach and setting your notifications to silent after a certain time at night can also be helpful. You can also try to dim the lights throughout your house wherever possible in the evening, an hour or two prior to bedtime, as we know that light coming into our eyes can prevent your natural melatonin from being released, which is what helps you to feel sleepy. Having a sleep routine is also helpful where you commit to going to bed and waking up at the same time each night to help your body get into that rhythm and know what to expect. The last piece that I want to talk about when we're talking about any type of lifestyle changes is in regards to your exercise levels. Now, there are a few different strategies for exercise that are more relevant during the perimenopausal timeframe, and these are high intensity interval training, or HIIT, and yoga or Pilates. Now, HIIT exercise kind of always keeps your body guessing as to what's coming next. It allows you to get some of that higher intensity for shorter bursts of time. The other bonus is that many HIIT exercises also have a strength training component, which is especially important again for building that bone density and helping to prevent osteoporosis as you continue to age. The other type of exercise that is great during the perimenopausal time is yoga or Pilates. Now, both of these have been found to reduce stress levels and improve flexibility, but there are also some really great research studies that have been done that show this type of exercise can also reduce the symptoms of perimenopause as you start to experience them. Now, I generally recommend at least 30 minutes of any of these types of physical activity at a minimum 5 days per week to try and help offset not only the weight challenges that you may experience during this time frame, but also to really help minimize those perimenopausal symptoms. So if you're having perimenopausal symptoms and want somebody to talk to who can help you navigate those changes and challenges that you're experiencing, our team would love the opportunity to work with you. Our fertility awareness charting instructors are trained to help you chart your cycles in a way that helps you better understand what's going on with your body. The evaluation that I do from a medical standpoint can help give you answers as to exactly what's going on with your cycles and develop a strategy that works for you to manage your symptoms and get back to your normal daily life. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for healthcare. We customize your treatment plan and include options to access a hormone coach, fertility awareness charting experts, a registered dietitian, a health coach, and of course, all the medical care you need from me as a board-certified physician. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.